Here are some notes on opioid tolerance. Tolerance is a state of decreased susceptibility to the effects of a drug. This applies to the adverse effects of the drug as well as the therapeutic effects of the drug. In the case of opioids, you can have nociceptive sensitization, which is characterized by paradoxical response to the opioids. Opioids are supposed to take your pain away, but in this case, patients can have more pain, can become more sensitive to the painful stimuli, and these sensations can be similar to or different from the patient's underlying pain, and all this manifests as a result of tolerance. These patients can also have tolerance to the analgesic and euphoric effects of the opioids, and this tends to happen before the respiratory depression tolerance. This makes it risky to increase your opioid usage because you'll get used to the euphoric sensations, so those will become less effective before you get used to the respiratory depression, which puts you at risk for respiratory problems, decreased respiration, hypoventilation, and death. The FDA has published guidelines for the maximum amount of opioid usage you should have before it's considered opioid tolerance, and those are listed here.
Drug overdose has become the leading cause of accidental death in the U.S., and opioids are usually involved. Opioids are a class of drugs that act on the nervous system to relieve pain and can produce feelings of euphoria. Opioid chemicals attach to a small part of the brain cell called an opioid receptor. There are billions of tiny receptors that play different roles on the surface of neurons. Some receptors that affect feelings of pleasure and have the ability to relieve pain are naturally triggered by endogenous feel-good chemicals called endorphins. These receptors can be overwhelmed by the synthetic opioids in prescription painkillers or plant-based opiates like heroin. Opioids act on many places in the brain and nervous system, including the limbic system, which controls emotions, where opioids can create feelings of pleasure, relaxation, and contentment. The brainstem, which controls things your body does automatically. Here, opioids can slow breathing, stop coughing, and reduce feelings of pain. The spinal cord, which receives sensations from the body before sending them to the brain, where opioids can decrease feelings of pain even after serious injuries. It's important not to take more opioids than you are prescribed. Don't take other people's prescriptions, and never mix opioids with alcohol.